Hello, and thank you for joining me. Today we're talking about immunotherapy. Immunotherapy is a very exciting part of cancer treatment. It's been developing over the last several years and a very powerful part of getting into remission and staying into remission, and I'll show you why. But before we can go into talking about immunotherapy, I want to give you a little background on metastases. Now, some of you have heard of metastases. You know that it's the actual spread of cancer. Well, what's really important to understand about metastases is that chemotherapy and a lot of the common drugs don't necessarily work very well for metastases, but I want to show you the process and show you how it works. What you're seeing here is a tumor that's growing, and when a tumor gets about 2 millimeters in size, it starts to recruit a blood supply. And you can see the tumor here is expanding and growing, and then it releases growth factors. VEGF, tumor growth factor beta, interleukin 8, these are growth factors that tell the blood supply to come and grow around the tumor. So once that tumor is growing, here's where the metastatic process takes place. You can see that the cells will escape the tumor and go right into the blood supply. And then as they go into the blood supply here, they can spread to any part of the body, the brain, the lymph, you name it, bone, wherever the metastatic site is for the type of cancer that you're dealing with. And so it becomes critical, as you can see here. As you can see here, the cancer cell is moving through and eventually will make its way through the blood vessel and into another organ tissue. And here it'll spread to different parts of the body where you see the metastatic sites on the bone, the lymph, all throughout the body, it can spread. Okay, so now that you know what metastases is and how it works, immunotherapy is the way you best deal with metastases. Why? 90% of cancer patients die of metastases, not of tumors. If the tumors were to stay where they were, you would live, you'd be fine, but it's because they spread. And we know that chemotherapy aims to go after metastases and radiation really goes after targeted tumors. But the problem is it really doesn't effectively get all of the metastases because you have micro, baby metastases, you have metastases, cells that are dormant that can turn on at any time. You have large metastases, and you can't see all of these in imaging because they can be on a cellular level. So immunotherapy is virtually ignored by conventional cancer centers, and it's devastating because it impacts the outcome of patients' results with cancer. Now, we have different levels of immunotherapy. You have intro immunotherapy, diet, nutrition, supplements to build the immune system. This is a very basic level, and a lot of people that look at integrative care start here. Then you have mid-level immunotherapy, where integrative doctors will use intravenous vitamin C and other intravenous agents to stimulate the immune system and target it towards cancer. Then you have high-level immunotherapy, where you mainly see the conventional oncologists will recognize a little bit more, where you use cytokines and messengers or deplete certain things from the body so that you can tell the immune system to go after the tumor and the metastatic cells. And then at the very highest level, where you only see a few institutions in the world doing this work, is where you actually can take the patient's immune system, grow it in the laboratory, teach it to attack tumor. Here at Envita, we use natural killer cells, which is the latest technology in immunotherapy, and we can teach it to go after metastases and late metastases and go after cancer cells. So there are different levels of immunotherapy. We offer all of them, which is very rare to find in one center. And here's a tip for you. When you're looking at the different cancer centers that are out there and what they can do, all you have to do is look at what they're offering in immunotherapy, and you can see the sophistication and the level of care that's available and really how high-tech they are in helping certain cancers. We're super unique at Envita, and we have unique programs. Why? We focus on immunotherapy. It's not an afterthought. We know that the immune system is the first and last defense against cancer, and we can combine that with chemotherapy, other proprietary treatments that we use, so we get the whole body, all the treatments moving to get rid of the cancer. For a decade now, we've worked with the most complex late-stage cancers, and our team is an expert team, an international team that provides the best immunotherapies from all over the world, and many that we've developed on our own group. So I have good news for you. We can help you. If you're currently experiencing cancer, whether it's an early or late stage, you need to think about metastases. And don't rely on chemotherapy to do it alone. You need to make those changes in the body. You need to clean out the toxins, all kinds, from infections, chemicals, heavy metals, but you also have to stimulate the immune system and teach the immune system long-term to protect the body and go after cancer. Remember, the first and last defense against cancer is your immune system, and you need to focus on that when you're building your treatment treatment plan. We're here to help you. Please give us a call. Our team will walk you through the different options and treatment plans that are available for you. Thank you, and we wish you the best of health.